It's part of a strategy to combat vaccine hesitancy. Toronto's top doctor is recommending that students shouldn't be allowed to skip vaccinations because of religious or philosophical reasons. The World Health Organization identifies the reluctance or refusal to vaccinate despite the availability of vaccines as one of the top 10 global health threats and a growing concern in this country. It's estimated 20% of Canadian parents are vaccine hesitant, meaning they have questions about vaccines and go to the internet looking for answers instead of talking to their doctor.
They're on mommy groups and people are posting stuff, and the stuff is actually false. Some of the stuff is actually extremely convincing but completely false. And so that false information should not be available because it's swaying people in the wrong way. And so some of the recommendation is to ask these search engines to adopt only evidence-based, evidence-informed scientific information on vaccines to be allowed on their sites, and not stuff that people just post because they think is, they believe it.
The province says parents seeking an exemption for non-medical reasons are required to attend an education session to help them make informed choices. Currently in Toronto schools, about 1.7% of students aren't getting vaccinated because of philosophical and religious objections. In 2006, that rate was just 0.8%. It's a slow but steady increase according to Public Health.
Given the rise in vaccine hesitancy, we think it's critical that we prevent a future outbreak rather than waiting to respond after the fact. And that's why I think the Medical Officer of Health's recommendation, this is Toronto's top doctor, to get rid of these non-medical exemptions for vaccines in schools is a smart one. It's already being done in Washington and New York and California, and it's time for us to prevent the outbreak and not wait for it to take place.
The province says students who have a valid exemption can be told to temporarily stay away from schools in case of an outbreak, and a spokesperson for the Minister of Health says there's no plans on changing that approach. Now, this report will be taken in front of the Board of Health next Monday.